welcome to this afternoon's meeting. I wanted to, first of all, do a welcome to country quickly. If I can change my screen. Oops. The Sydney North Health Network wishes to acknowledge Australia's Aboriginal peoples, the traditional custodians of the land on which we meet and work. We pay our respects and recognise their continued connection to land, water and community, and honour their ancestors, elders past, present and emerging. I've just got a couple of housekeeping, which I'll just leave up on the screen while I introduce you to Alicia. Oops, sorry. So Alicia has 10 years experience working in the public health setting. She has had roles across the mental health hospital and sorry about that. Hospital and aged care sectors. Currently, she is employed as the community engagement consultant for the Care Finder program at YourSide Australia. YourSide is a non-for-profit organisation that delivers a range of aged care services and programs. Welcome, Alicia.
Hi, thank you. All right, so I'll just check, can you guys see my presentation up on the screen? Okay, perfect. Thank you. So yes, my name's Alicia. I'm the Community Engagement Consultant for the Care Finder program at YourSide Australia. So thank you to the North Sydney Health Network for having me in today to host the webinar. Specifically today, I'll go over what the Care Finder program is and how we came about, program eligibility, the Care Finder target populations, and practical ways that Care Finder workers can support vulnerable older people in the community, and also how you guys can make referrals into the Care Finder program. So I'd like to acknowledge the First Nations people of Manly. So I'm joining the webinar today from Garigal land, and I understand that we have people joining the webinar today from lands all across the North Sydney Primary Health Network region. So I'd like to pay my respects to the elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people joining us today. Now, I understand that we have people joining the webinar who work across many different GP practices or services or teams across the North Sydney Primary Health Network. And in your work, you may come across some older, more vulnerable older people who require a bit of extra support in navigating the aged care system. I'm sure the interactions that you guys have had with the aged care system, you'll understand that it can be quite complex to navigate, particularly if you're not sure what you're doing, or if you don't have the capacity to navigate the system on your own. People do end up falling through the cracks. So that's where Care Finder can help. So some people need a bit of extra and more intensive support to set up their aged care services or change their aged care services. So our program sits alongside My Aged Care as a supplementary program, and we support those people who need a bit of intensive support to navigate that My Aged Care system. And we can also link people up with other supports in the community as well to ensure that there's wraparound supports for that older person into the future. So how did Care Finder come about? In 2018, there was a Royal Commission into aged care quality and safety. This Royal Commission found that there was a big gap in the aged care system in that there was a lack of face-to-face support for older people. And this meant that some older people who were experiencing barriers to accessing aged care were falling through the cracks and they weren't accessing aged care at all. So the government spent the next 4 years between 2018 and 2022 trialling different pilot programs to address this gap in the aged care system. And in 2023, CareFinder was implemented as one of the longer term measures to help address this gap. So we've been up and running since about April last year. So we've been around for just over a year now. In order to be eligible for the CareFinder program, you must be over the age of 65 if you're in the general population, or over the age of 50 if you're First Nations, or if you're at risk of or experiencing homelessness. And you must also be experiencing one or more of the barriers on the screen, which are inhibiting the person from accessing aged care through the typical avenues. So most older people will go directly to My Aged Care to set up their aged care services. They can do so either by ringing up or going onto the My Aged Care website to organise an assessment and register themselves. But for some people, they don't have the capacity to access aged care through the My Aged Care system themselves. And this might be because they're experiencing a communication barrier. Perhaps they have difficulty understanding information or making decisions. They might have a reluctancy to engage with aged care, perhaps due to past trauma or discrimination or a mistrust of government services. Perhaps they're at risk of homelessness. There's many different reasons or circumstances as to why someone might be falling through the cracks in aged care. But essentially, as long as they meet the aged care criteria and they're experiencing one or more barriers to accessing aged care, then they will be eligible for support through the CareFinder program. So our target populations are quite diverse, and the government was quite intentional in not wanting to have too many eligibility criteria for our program, because we are designed to support the most vulnerable people and the most vulnerable older people in society. So you can kind of see the bit of the list on the screen. It's not an exhaustive list, but some typical populations that we see coming through the CareFinder program are people that are very isolated and who have limited support, people that have communication or language barriers, people who are in crisis or at risk of being in a crisis, people with mental health or AOD concerns, people who have experienced domestic family violence or elder abuse, veterans, refugees, migrants, and the list goes on. CareFinder can support older people in very practical ways. So we're a free face-to-face program, and we go out into and meet our clients either in their homes or in the community, wherever the client's comfortable. And we can practically support our clients by helping register them with My Aged Care over the internet. We can help our clients to ring up My Aged Care to help answer the questions during the registration process as well. We can help our clients to complete or understand the forms with service providers. We can help our clients by being a support person and attending their assessments with them. Our CareFinders can also research and shortlist different aged care providers in the community that can provide the services that client's been approved for. So that's often the part of the aged care journey where people end up finding very difficult to navigate that part of the system, because the onus is often on the older person to research and find aged care providers themselves. And as you can imagine, if you don't have the capacity to spend hours going through the internet and reading information, understanding the information, seeing which providers offer which codes in which areas, it can be very complex. So our CareFinders can simplify that whole part by shortlisting different aged care providers in that older person's local region to help that older person to make an informed decision about their aged care moving on. And the CareFinder will then, over the longer term, continue to check in with that older person to make sure that their services are meeting their needs and they're working appropriately. If they're not, then the CareFinder can help the older person to change their aged care services. And additionally, CareFinder can also work outside of the aged care system by linking older people up with other services that they provide as well. So for example, if the older person is experiencing isolation or loneliness, then the CareFinder can look up different social connection, community support groups in the local area, such as men's sheds. If the older person's experiencing mental health concerns or AOD concerns, then the care finder can make referrals into other services that specialise in mental health or that specialise in AOD. So we're quite responsive to the needs of that particular older person, and we do work with quite complex cases. So the care finder will ensure that whatever the circumstances are that that older person has found themselves in, and for whatever reason that they've fallen through the cracks, the care finder will do their best to address and ensure that there's wraparound supports moving forward for that older person. So our care finder team, we currently have 3 intake officers and 18 care finders. Across the team, they speak, I believe, 13 different languages. So we do our best to link a client up with a care finder that can speak their preferred language or that has special expertise in a certain area of the health or support system. So for example, we do have mental health nurses as care finders, we have social workers, we have a range of different disciplines within the care finder team, and we try to link the care finder up with the client that can best support them. So for example, if the client's experiencing homelessness, we do have a few care finders in the team that have experience working in the housing and homelessness sector. They know that sector really well. So then they can provide that expertise to help address that older person's housing situation. The same for clients that are experiencing perhaps poor mental health, then we might link them up with the care finder that's the mental health nurse to specifically meet their needs in that area as well. The journey through Care Finder is different for every client depending on their circumstances and what types of services they'd like to bring in. But essentially, once a referral is made into the Care Finder program, our intake team will receive and review that referral and then allocate it to the most appropriate care finder. The care finder will then phone the client to do an initial onboarding and to set up the first appointment. And the first face-to-face appointment usually happens within about a week. So we do have quite a quick response time, although we're not a crisis service. So we do operate between the 9 to 5, Monday to Friday hours. During the first face-to-face visit, the care finder will spend a lot of time rapport building, getting to know the client's situation, understanding what informal or formal supports the client might already have in place, understand what the client's goals are and what services they'd like to bring in. And then they'll spend the next couple months walking that client through the aged care system and also linking them up with those other supports in the community as well. So once the supports are all in place and they're up and running, the care finder will take a bit of a step back, but will continue to check in to make sure that the services are still meeting the needs of the client and to make sure that the client's needs haven't changed. If they've fallen ill or perhaps had a fall, the client might need to then be reassessed. The care finder can help with that process as well. However, if the services are meeting the client's needs, then we can close the case. And if in future the client's needs change again, and they need some extra continuing support, we can very easily reopen the case with no need for a new referral, and there's no expiry date for the initial referral. The client would just need to ring up the care finder and we can simply reopen the case and then continue to support them. We try to ensure that the care finder program is very accessible and easily accessible for our clients, as they are the most vulnerable older people in community. So we want to make sure that we're not putting any additional barriers in front of them when they're trying to access aged care. Now, Care Finder is an Australia-wide program. It's funded federally through the primary health networks, and each primary health network is responsible for managing the Care Finder program within their PHN region. So YourSide has been commissioned by the North Sydney PHN and the Western Sydney PHN to deliver Care Finder in those PHN regions. But as I mentioned, the program is available Australia-wide. Depending on which PHN region your patient or your client lives in, you'll need to go through that local PHN to refer that client into the local Care Finder program. So as I mentioned, we deliver in North Sydney PHN, of course, so that's from all the way up the top of the Northern Beaches down to Hunters Hill, Ryde area, across to Hornsby, Ku-ring-gai. We also deliver in Western Sydney region, and we specifically deliver the program in the Parramatta Cumberland region. And there's 3 other community organisations as well that we deliver the program with in Western Sydney. Aspire for Life deliver it essentially everywhere else that YourSide doesn't deliver. And then Hammond Care and Wesley Mission deliver the Care Finder program in Western Sydney with a homelessness population focus. So each PHN does commission the program slightly differently. Some PHNs choose one organisation to deliver the program, such as in the Northern Sydney PHN region. Other PHNs will commission multiple different organisations to deliver the program. So it works a little bit differently. I would just encourage you to go to the local PHN website to find which organisation is delivering the program in that client-specific region. There's a few different ways that you can refer into our Care Finder program at YourSide. So you can go onto our website and go onto the Care Finder page, and there is an online referral form. I'd say for service providers and GPs, that's probably the easiest way for you guys to make a referral into the Care Finder program. You will need the patient consent or client consent, and there are a few questions on the referral form about the client's circumstances, situation, what informal or formal supports they have. So I would just encourage you to include as much information as possible so we can make sure that we're allocating that client to the most suitable care finder in the team. You can also do the referral directly over the phone directly with our intake team and do an over the phone referral. Clients can also self-refer into the Care Finder program as well. So any service provider can refer or clients can self-refer. Thank you. And I think we have left some time as well for any questions from the group. If anyone has any questions, I'm happy to answer them. And I'm also happy to provide these slides as well if anyone would like to review them after the talk today.
Alicia, we've got a question from Heather Knox. She wants to know, is the referral form available via HealthLink? And I'm not sure whether you know what HealthLink is.
Yes, I do know what HealthLink is. Unfortunately, I don't believe our referral form is available on HealthLink, but I will need to double check that. As far as I understand, I think it's just through the intake line number over the phone or through our website at this point, but I will double check that. I know a lot of GPs will often use, HealthLink to make the referral. So it would be handy to have it in there. So we should look into that.
Is there any other questions? People can raise their hand if they want to ask their own questions. I can't see any raised hands. We will share the slides. Alicia is very happy to share the slides, which has got all the referral information in it. I think, Alicia, is it okay if we send your email address with that too, so that we can
Yeah, absolutely. And I'm also happy to, if anyone would like any Care Finder brochures to hand to your patients or clients when you're making a referral, I'm happy to organise to have some sent to your offices or your practices if you'd like some brochures in stock too.
Great. And Heather actually has a question that she wants to ask. Heather.
Hi, thank you. I just wanted to check that it's it's more, and this might be an old question, in that a lot of families talk about there being a wait for certain packages to be available. And I suppose it's just checking it's more than kind of trying to jump that waiting period and stuff like that, or is this the kind of circumstance this might be used in?
No, that's a great question. Thank you, Heather. So we are not able to help people jump the queue, or we can't shorten wait times either. So unfortunately, we do have to work within, you know, the bounds of the existing aged care system, and there are quite extensive wait times at the moment. I think our care finders are reporting for a level 3 home care package, some clients are waiting over 14 months to receive funding. Unfortunately, we can't help people to skip the queue, and we can't shorten the wait time. But what we can do in the meantime is look outside of the aged care system and see if we can find some short-term support for that client, perhaps through the Carer Gateway, perhaps through other community organisations that might provide free meals, things like that. We try to get a bit creative to make sure that there are services in place for the client while they're waiting. But unfortunately, we can't shorten wait times for the My Aged Care home care packages or for the Commonwealth support program either. But we'll do our best to make sure that other supports are brought in that short-term period to make sure that that person can live safely and independently at home in the meantime. Thanks.